Hello, this is Dr. Dheeraj Masapu, and in this video, what I'm going to tell you is which medical specialty can get you to a 10 crore mark fastest is what I'm going to tell you. So I have divided, all the specialties into four buckets, basically. So one is a physician bucket where I took general medicine as an example. You can put all your physician type of specialties there. And then I took a surgical bucket where I took OBG as an example for that. All the intervention and surgical specialties would be explained there. And then I took anesthesia and as a one other bucket where I wanted to keep a job kind of a salary structure, and the last bucket is a pre and paraclinical bucket where I took pathology as an example. So in these four buckets, who can actually reach 10 crores fast? You will be shocked to see the result actually, which I would be telling as usual in the end of the video. First, let me tell you why I took 10 crore as the mark. The reason is 10 crores if you put in the bank, 6.25% interest is what you get now. If you get 6.25% interest, that means 6.25 lakhs per annum is what you get as interest. Okay, this 6.2 lakhs, if you divide in month, 5.2 lakhs per month is what you get. So 6.2 lakhs per year is what you get. For 5.2 lakhs per month, you would get. So imagine 5 lakhs if you're getting in a month. That is, you can live luxuriously. That is why I took 10 crores as a mark. But here a small catch is that Indian taxation system, if you understand, 30% slab is there, okay, for anything about 12 lakhs. So what happens is, unfortunately, this particular, in this 5.2 lakhs again, they will deduct the tax and you would be left with 3.65 lakhs per month after the tax cutting. Even that's a very good amount if you have 10 crores in your FD. So that is why I took the 10 crore as a mark. And so if you are thinking that why is Dr. Dheeraj doing about money and all that, I know money is not everything in life, but this is a kind of indirectly I'm trying to make students realize how the healthcare system works, so that they get an understanding of how healthcare systems work. And explaining through money is an easy way for me to actually explain younger students to take informed decisions and understand how healthcare actually works in different areas. So that is the basic intention behind doing this particular video. If some seniors are actually watching this, okay. Anyway, let's see the physician bucket first. General medicine, I'll start with. So general medicine. If I'm talking about general medicine, you can put everything here, dermatology, this thing. Whoever is actually working in as a physician OPD, you can put in this bucket. So here, how much you can earn average is, for example, if you're charging 500 rupees per patient, okay, if you set up your own OPD and if first 10 years on an average, 20 patients are coming in a day, and 10 years later, 40 patients are coming for you. Let us assume that. Okay, if you are a very that is these are the average numbers actually. There are some people who will say 80 to 100 patients also in a day, but average numbers we shall take. And along with that, you can have some kind of a pharmacy attachment, and also you can have a lab attachment where you get some margin in the sale of the medicines and investigation. So at the end of it, what kind of money you might get is, for example, if your OPD fees, pharmacy profit, and lab profit, everything, if you consider around 12,000 per day is what you can make if you're seeing 20 patients. If you're seeing 40 patients, obviously you'll make 24,000 in a day. Okay. And then, so with this kind of earning as a physician, I will tell you how much time it would take to make 10 crore rupees. So let us take you're working for 300 days in a year or 300 days you're seeing OPDs. And then what thing is like first 10 years by, you'd be making anywhere between 12,000 rupees per day, with all this income. So first 10 years, you would make around 3.63 crore. So you're left with 6.37 crore. So this 6.37 crore in the next 10 years, I told you would be making 24,000 rupees per day. So it would take another around 8.8 years. So total 19 years roughly it will take for a physician with OPD practice to reach 10 crore mark. Okay, with an average practice. So that is the time it would take to reach 10 crore. So keep that in mind, 19 crores. So then we'll go to the next area. So next area that I would like to talk about is the OBG. So OBG by per se, if I am talking about OBG, that means that all the surgical and intervention-based specialties can be included here. So I am assuming that OBG doctor who is doing an average practice or little successful person after certain years of experience would be doing one LSCS in a day. And if she is working in a in a corporate hospital, or if she's doing a hysterectomy or something, so per case her surgery charges would be anywhere between 15 to 20,000. Okay, and then one case in a day if she does. And along with that, she is also seeing 20 patients in a day in OPD as consultation, and some kind of pharmacy attachment and all that is there for her. And she's working 300 days in a year. So with all these assumptions, if you calculate for LSC is 20,000 per day, OPD 20 patients and 500 rupees per patient, and pharmacy profit of 800 rupees per day, total of 30,000 they would earn in a day. So in this, if I calculate per year, they would make anywhere between 92 lakhs 52,000, and roughly it will take around 10.8 years or 11 years to reach the 10 crore mark. Okay, so this is the calculation which I did. So this is mainly for a gynecologist who is doing one LSES in a day and 20 patients OPD with a pharmacy attachment or something like that. So if somebody is watching this video, then if you're thinking, how doctor, how can you talk about having a pharmacy attachment being a doctor? There is a detailed video I have done. Doctor can have their own pharmacies. There are certain rules and regulations for that. You can watch that video in my channel. Okay, the different schedules of drugs, only schedule X and schedule something else is there. You cannot have in your pharmacy, but other medicines you can have. Okay, and that is about the pharmacy part. So this is okay, for gynecology or any intervention specialty, around 11 years it will take. Okay, this usually, if I mean 11 years, around 3 to 5 years, initial period as a surgeon you have to remove because they'll work as a junior or they will try building their practice, they will brand themselves and all that. Okay, you can add another 2 3 years further, or 13 to 14 years is what you can take. Next specialty which I'm going to talk is anesthesia, and here you can keep all your emergency medicine, radiology, PMR, and all the specialty where a kind of a job you would get here. There are anesthesia freelancers also, but let us not talk about them in this particular video. And we'll only talk about anesthetists who are working in corporate hospitals in a job manner. So how their salary progression would usually go is first 1 to 3 years they would get 1 lakh in a month, and then year 4 to 6. I mean, after 4 years they would get 2 lakhs. After 7 to 8 years experience they will get 3 lakhs. After 10 years they would get 4 lakhs. This is the assumption I took. So like this, if you do so, then first 1 year you'll get 12 lakhs per year. After that, stage two, that is 4 to 6 year period, you will 24 lakhs in a year. And stage three is that 7 to 9 year period. They will make anywhere between 36 lakhs per year. So like that, if you see all this cumulative earnings, then what happens is, so they would take around 25 years to reach a 10 crore mark with the gradual salary progression. Okay. So this is the a number of years it would take if you're actually working in a place in a salary format. Okay. So that is 25 years. And pre and paraclinical specialties for, examples like I took pathology. So I had to search the websites on what are the salaries of pathologists in Bangalore medical colleges. Around 85,000 to 1,10,000 is what the assistant professor would get. And there are some around 8 to 10 lakhs per year is what they would make initially. But with mid-level experience, after 5 to 8 years, they would make between 15 to 25 lakhs. And later on, there are some people with the professorship and all that once they get 25 to 35 lakhs also they would make in academic centers. So if I do the math here, so then year 1 to 3, around 10 lakh per year, year 4 to 7, 18 lakh per year, year 8 to 12, they would have 28 lakhs per year, year 13 plus 35 lakhs per year is what the assumption I've calculated. And then by this calculation, it would take 33 years to reach 10 crore mark with this kind of salary. So to summarize, so any medical specialty based, medical OPD based specialties would take 19 years to reach 10 crore mark. Gynecology, example I've taken, any intervention based things would take 11 to 13 years to reach the 10 crore mark. Anesthesia, where a salary ladder is there, anesthesia, ER, transfusion, PMR, infectious, all those things would come in this bracket. Around 25 years they would take to reach the 10 crore mark. And then any pathology, pre and paraclinical would take 33 years to reach the 10 crore mark. Okay, if you do pathology and go into some pharma company, then you would have a career like the anesthesiologist, radiologist, and those people. Then you can actually reach a 10 crore mark by 25 years. So to conclude, okay, the winner, clearly, it is it's not OBG alone, it is the intervention based specialties or surgical specialties. Okay, then if you ask me what is the list of surgical specialties, general surgery, orthopedics, OBG, ENT, Optal, and after MS, you can go into urology, neurosurgery, cardiac surgery, thoracic surgery, and all those things, and then gastrosurgery, plastic surgery, oncosurgery, And not only this, there are so many intervention, medical specialties also, like cardiology intervention they do, radiology intervention they do, gastroenterology, ERCP, and all these things they do. Pulmonology intervention is there. Dermatology also intervention is there. Cosmetology, lasers, Botox, fillers, and all these things are there. And neurologists also are entering into intervention neurology. They do mechanical thrombectomy, stroke procedures, and all that. Pain after anesthesia, you can venture into pain and do all the nerve blocks, RF ablations, and all that. So, bottom line is intervention-based specialties can reach a 10 crore mark little early. So this video I did for counseling going people to have an understanding of how healthcare works, how many years it would take to reach the 10 crore mark is not the main thing, but if you understand how healthcare works, and then it will be very easy for you to take the decision and very easy for you to actually understand how to prepare yourself in the post-graduation period also when you come out. So that is the basic agenda behind doing this video. So if you want to sit one-on-one with me and understand how to actually progress your career, how to plan your career, or you want to go to abroad or something like that, you want to discuss one-on-one with me because I gained a lot of knowledge in this area by discussing with multiple people. There is a link in the description. You can sign for my mentoring program and we can sit one-on-one with you. So that's the thing. And thank you very much, guys, for following the video till the end. And as usual, Dr. Dheeraj Masapu logging off. Roger that.